So even though when it comes to hormones and testosterone, we oftentimes think, oh, the low T guy, he wants to gain muscle for the gym. He wants to look good in his muscle shirt. He wants to have better sex and he wants to increase his libido. So many of the guys that I see, they want to improve their mood. They want to just have an overall sense of well-being. They want to have more pep in their step. They want to improve their cognitive function and their anxiety. And so many of those other factors actually have nothing and yet everything to do with men's health.
Low testosterone continues to remain a hot topic and is a common issue for men, especially as they get older. I'm excited to be kicking off the 2024 Prostate Health Podcast season with two amazing guests today. You'll definitely want to listen in as we demystify numerous strategies for hormonal optimization to help you in living your best life in 2024 and beyond. So the big question is this: how can men and those who care for them better educate themselves regarding prostate health, the conditions that affect the prostate, and the latest technology in managing these conditions? That is a question, and this podcast will provide the answers. On the podcast, we'll be chatting with experts, innovators, and leaders in the field of urology, sharing useful information with the general public to improve their lives and increase their overall health. My name is Dr. Garrett Pohlman, and welcome to the Prostate Health Podcast. Prostate Health Podcast is for informational purposes only. Nothing in this podcast should be construed as medical advice. By listening to the podcast, no physician-patient relationship has been formed. For more information and counseling, you must contact your personal physician or urologist with questions about your unique situation. We have several firsts today on the podcast. Not only is it the first time we have a urologist and gastroenterologist combo on the podcast, well, actually the first ever gastroenterologist on the show, but to also have a sibling duo. I'm excited to have joining us today on the Prostate Health Podcast, physicians and sisters, Drs. Amy and Michelle Pearlman. Dr. Amy Pearlman is a board-certified urologist specializing in male sexual and hormonal health, as well as genital reconstruction. She completed her urology residency training at the University of Pennsylvania and fellowship training in urologic reconstruction, prosthetic urology, and infertility at Wake Forest University. Though trained as a surgeon, Dr. Pearlman's primary mission is to educate people on the basics of their bodies, to encourage health behaviors to optimize health, and to help people live their most authentic lives. Dr. Michelle Pearlman is a board-certified gastroenterologist and obesity medicine specialist. She completed her residency training at the University of California, San Diego, and gastroenterology fellowship at the University of Texas Southwestern in Dallas. As a board-certified gastroenterologist, she understands the importance of gut health as it pertains to dietary habits and maintaining a healthy weight. Drs. Pearlman and Pearlman, welcome to the Prostate Health Podcast.
Thank you for having us. Good to be here today.
Now, you both recently left your careers in academic medicine to start a private practice together in South Florida with the Prime Institute of Miami. Now, some of our listeners might be already thinking, how do urology and gastroenterology fit in with each other?
That's a really great question. And honestly, one of the most common questions we get asked. And it's interesting because within a urology practice, so much of what we see on a daily basis actually starts with using food and exercise as medicine, right? We call it lifestyle modification, and we tell our patients to eat better, move more, eat healthier, get to a healthy weight, but we oftentimes don't give them the tools. So my practice working with my sister, who is a gastroenterologist, actually allows us to give people tangible tools to actually implement lifestyle modification.
Yeah, and I think the other thing we also come across is when we talk about the pelvic organs, whether it's the bladder or the intestines, right? They're all so interconnected. So if a patient is struggling with urinary retention or urinary issues, oftentimes there's an overlap actually with, let's say, constipation or pelvic floor dysfunction. So although we deal with separate organs, there's actually a lot of interconnection between them just because of the proximity of the organs.
Yeah. And what's also interesting is my sister is a gastroenterologist, is oftentimes the first person to check testosterone levels in men when they're struggling to lose weight because of that interplay between obesity and low testosterone.
Well, there certainly is an obesity epidemic in the U.S. 2 in 5 adults are obese. And looking at the criteria, a man who is 5'10" with a weight of 209 pounds or more would be considered obese. And we know that obesity is linked to numerous health conditions, including diabetes, heart disease, stroke, and a number of cancers. So what impact does obesity have on testosterone levels?
Yeah, it's interesting because when you mentioned some of the reasons or associated conditions with obesity, you mentioned heart disease and diabetes, and those are the number one and number two causes of erectile dysfunction, which we see all the time in a urology clinic. But it's really the same thing with testosterone. Any chronic condition will lower someone's testosterone levels in addition to any acute condition. So there's so much interplay between most people who have obesity are going to have hormone issues. And a lot of guys who come to see me with low testosterone will also have hormone issues as well.
Yeah, when we talk about the prevalence of these conditions, being overweight or obese has unfortunately become the new normal. That when we see someone is normal weight or losing weight, we often make an assumption that someone must be sick or they're just not eating enough or they're malnourished. And so it's really key to understand that because we're seeing more and more obesity, we're also going to see more other conditions that are related to male health and particularly hormonal health.
Yeah, but it's not a simple association. Like if someone improves their obesity and loses weight, it doesn't necessarily mean they're going to have rock star hormone levels. And this is both for men or women. And really the same thing with my field is if I treat someone's testosterone, it doesn't all of a sudden mean that I'm going to treat their obesity. It's really this complex interplay between adipose cells and hormone levels and inflammatory markers and cytokines and insulin resistance. Like everything plays a role and it's not one or the other. And we used to see, used to think that fat cells were just maybe cosmetically displeasing. But what have we found, like Dr. Pearlman, in terms of fat cells in the body?
Yeah, it's very interesting. So when I was in exercise physiology way back in the day in undergrad, although not too long ago, shall we say, we were taught that fat cells just kind of sit there. But more and more, we actually realize that they are extremely active. They are extremely pro-inflammatory. And if we can shrink the adipocytes and get rid of fat cells, and we can reduce the systemic inflammation, people feel better. They sleep better. They have lower stress levels. We can lower their cravings, and we can also protect all of the organs and improve hormonal health. So it really comes back to reducing systemic inflammation.
It is well known that exercise is good for your heart, mental health, as well as offering additional health benefits. But how does hitting the gym actually affect a man's testosterone level?
Yeah, that's a common question too, because oftentimes when we think about testosterone and hormones, our minds oftentimes go directly to the guy at the gym who's bodybuilding and on testosterone to help him grow big muscles. But that's not really so much of what guys come in to see us for with low testosterone is actually not muscle building, although they do want to gain lean muscle mass, but it's just feeling better, right? So resistance training is key. And even using a dumbbell like this, a 5-pound dumbbell, we keep these in the office too, just to show patients what we mean. But we know that exercise improves hormones. We know that strength training, at least temporarily, will improve testosterone levels. So, but at the end of the day, there's not one specific exercise or one specific training program. And I don't think we're ever going to come up with the answer to that, right? We always want to know, what are the top 5 foods? What are the top 5 exercises to improve hormones? But at the end of the day, it's even better, I think, that we don't have the one single thing, because it means then people can figure out what works for them on a daily basis to incorporate resistance training, which you talk about all the time with your patients.
Yeah. And I get a lot of these guys that come in middle age, or let's say they're in their 60s or 70s, and they feel like they're pretty husky. And I get them on my bioimpedance scale and I'm alarmed. I can literally, without even checking their blood work, I know they have low testosterone because their muscle mass sometimes doesn't even register in my chart. And it's not that a man's testosterone automatically drops at the age of 60 or that they all of a sudden develop sarcopenia. It unfortunately is decades worth of behaviors, right? It's when we enter the career force, we're sitting down at the computer all day. We put everyone else in front of us and we become the last priority on the list. It's decades worth of behavior where we lose muscle over time. And as we get older, for men or women, our hormones change, testosterone drops, estrogen drops. And so we then actually really increase the rate at which we lose muscle later on. And the muscle is the key to our metabolic rate and so many other things. So from a weight perspective, we know that exercise is actually not a good tool for weight loss, but it's incredibly important for every other aspect of our health and a critical piece for not losing weight, but maintaining our weight loss. And again, it all goes back to muscle mass. Now, I can have someone eat a lot of protein and go to the gym and work out and do resistance training. But if we don't optimize their hormones and their testosterone is low, it's going to be very challenging for that person to gain muscle or even just maintain muscle.
Well, certainly excellent points there. Now, when it comes to diet, weight management, and hormonal health, I know our listeners here on the podcast would be curious to know your thoughts on if there are any particular foods that support testosterone production and weight loss.
So we have some great options, and we actually want to provide some examples because so much of what we emphasize to patients is it's not about making the perfect choice every time. It's about making the next better decision. So we want to give some examples of healthier snacks. And as I, briefly alluded to, there aren't like the top 5 foods to eat, right? So just figuring out in terms of your GI symptoms and your preferences and what you like and what you don't like, what to eat. But I do want to clarify a common misconception about soy products, estrogen, and testosterone. So there have been studies to show that it's perfectly fine to eat soy products, that things like tofu and edamame will not increase a guy's estrogen level or decrease his testosterone level. So in terms of a good snack option, like edamame beans are a really good option, and these are dried out, so it adds a crunch. Michelle, what are some other recommendations you have for healthy foods that are also anti-inflammatory?
Yeah. So when we talk about inflammation, right, that really drives a lot of chronic illness. So we need to focus on how do we provide anti-inflammatory foods to the gut. Our gut is our largest immune organ. So if you think about it, oftentimes we put nutrition as like an alternative method, or it's considered alternative medicine, when in fact, we know that nutrition and moving our body on a regular basis is the foundation for everything we do to live our best life at any age. So what we feed our gut has a huge role and immediate impact on inflammation. So when we talk about anti-inflammatory foods, it can actually be fairly simple. It's fruits and vegetables, nuts, seeds, whole grains, lean protein. The problem nowadays is everything is ultra processed. So if I were to, let's say, get deli meat that has all these nitrates in it and all these other chemicals, it may be a lean protein, but a lot of these other extraneous chemicals can actually increase risk of colorectal cancer. So my whole kind of spiel is I need to be able to identify where the food came from. If I can't identify what it is, we probably shouldn't be eating it. Our body probably can't recognize it. We have more autoimmune conditions nowadays than we've ever had before, and our genetics haven't changed, but what we're eating has changed, and that changes the way that our genes are expressed. So let's go back to things that are easy for people to implement when it comes to anti-inflammatory foods. Again, it's nuts or seeds. Now remember, too much of a good thing can be a bad thing. So if you're going to Costco and getting a huge bag of nuts and you're sitting in front of the TV and you have handful after handful, eating 1,000 calories worth of nuts is not going to help you. So the snack packs are incredibly helpful and also very travel friendly. So little snack packs of cashews or these little snack packs of like almond butter. And remember, when we talk about testosterone and maintaining muscle mass or building muscle, protein is the key macronutrient. So also finding foods that are dense in protein. This almond butter has about 10 grams of protein. Other options would be like chickpea pasta, another great option for good dietary fiber as well as protein. And hemp seeds are also a great one. But remember that just because something has tofu, if you're frying it in a bunch of oil and adding a lot of other ingredients, it kind of negates a lot of the positive factors.
Well, we hear a lot about the mind-body connection in weight loss and hormonal health. Could you touch on the psychologic aspects of weight loss, stress management, and their influence on hormonal health, including testosterone levels?
Yeah, my goodness, we often are taught it's the mind and the body like they're two separate entities. And that couldn't be so far from the truth. The mind and the body are one and the same. We have the brain and the gut connection. It's one axis, and we have all these biofeedback loops. What we know more.
And we also have the brain ball axis, which I like to talk about for the testicular system.
Yeah, exactly. The microbiome is an organ in itself. It's all the bacteria, the fungi, the viruses that inhabit our gut. And that actually plays a huge role in sending neurotransmitters back to our brain that then influence our satiety signals, our pleasure signals, our, whether or not we're having cravings or hunger. So what we feed our body, if we eat the right things, these anti-inflammatory foods, it promotes a more diversified microbiome. Then it sends signals back to our brain that make us feel good and make us feel satisfied. Now, when we eat foods that have high fructose corn syrup or fried foods, it has the opposite effect. It's pro-inflammatory. It messes up our microbiome and causes a disarray of it. And then we have more cravings and more hunger, more weight gain, more systemic inflammation. So food is incredibly important. Food truly is medicine. Now, Dr. Amy, tell us about the hormone side.
Yeah. And I just want to go back really quick to something that you mentioned. So many of your patients are lawyers and they are very stressed and they're sitting down all day. And some of them, come to you because they have these very expensive suits and they want to look good in their power suit when they're in trial. We oftentimes think within healthcare, if someone wants to lose weight to look better in the mirror, that's something that's vain, and it's not vain. And we really promote with anyone that we meet that if you want to look in the mirror and like what you see, that is reason enough to see someone like us. And in my clinic, we oftentimes, most of the patients that I see are men. And we oftentimes think that only women care about their bodies. Men extremely care about their bodies. And there's nothing wrong with a man also wanting to look good in his power suit. So even though when it comes to hormones and testosterone, we oftentimes think, oh, the low T guy, he wants to gain muscle for the gym. He wants to look good in his muscle shirt. He wants to have better sex and he wants to increase his libido. So many of the guys that I see, they want to improve their mood. They want to just have an overall sense of well-being. They want to have more pep in their step. They want to improve their cognitive function and their anxiety. And so many of those other factors actually have nothing and yet everything to do with men's health.
Now, as you mentioned, many of these men are candidates potentially for testosterone therapy. What options are available as they consider proceeding with therapy?
So my conversations with men used to be very different than they are today when I first started out in practice. And especially if a guy who was overweight came in, I would discuss with him what a lot of providers do, which is move more and eat less. And when you lose weight, your hormones will improve. And so we'll reassess in a few months and we'll see how you do. But the reality is the majority of people who are overweight will not be able to lose weight on their own with diet and exercise alone. They need additional tools in their toolbox.
Well, and really quick, that's what I used to tell patients too a couple years ago before we had these next generation medications that were really, really effective, is I'd put them on a regimented diet plan. I'd have them move more. Some of them would lose weight. The majority would not. And unfortunately, in those circumstances, we as providers often deem them a failure of lifestyle modification when the numbers actually show only about 5 to 10% of those patients will be able to lose weight with diet and exercise alone. So the majority of people need help. And so it's not good enough for us to just say, eat less, move more, and only if you fail, then we can offer treatment. So Dr. Amy and I are actually very aggressive up front because most of these people have been struggling for a while. This is not their first rodeo.
Exactly. And so when it comes to hormones, now I say if your hormones are low, let's treat you with testosterone, because oftentimes they have a little bit more energy that when they get home from work, they have enough energy that they want to go to the gym. And because they're going to go to the gym, they're not eating like crap when they get home. So if you were to take apart a watch, we're just trying to move that first rung of that watch, because if you help someone feel better in one aspect of their life, it's going to improve the next aspect and then the next aspect. So for some of my patients, we treat one thing at a time. And for others, we might try to tackle 5. There's a balance between not overwhelming someone, but also providing holistic, comprehensive care. The good news is we actually have a lot of options when it comes to restoring someone's testosterone levels. And testosterone formulations have really come a long way. I'm so excited that we now have oral formulations for testosterone. I really think this is a game changer. People have been asking for oral options when it comes to testosterone for many years, and we finally have a safe option. Now, with Kysotrex in particular, and this one came out, was FDA approved about a year ago, this specific formulation is different from the others. And I want to really emphasize some of the key points here. Especially if you're a healthcare provider listening, this is really key. So Kysotrex is cash only, meaning you don't have to go through the whole insurance process and prior authorizations When the patient is in your office, you can tell them in real time how much this medication is going to cost them. And I think that's cost transparency in its finest. It allows patients to decide in real time whether or not that's going to work for them. I hate sending patients to the pharmacy. The pharmacist tells my patient that it's going to be $600. The patient has no idea that was going to be the cost. They call the doctor's office. There's a lot of back and forth. They come back 3 months later and we realize that we never even got that patient on any treatment. We wasted a lot of time. So that's one really big advantage. But interestingly, this medication in particular, Kysotrex, is the first time that a prescription drug has phytosterol esters, has been shown to have cholesterol-lowering properties. And we may know of these things in commercially available products like foods, nutritional supplements, but this is the first time that they're actually in a prescription medication. So at the end of the day, formulations, there are many. And I love the innovative approach when it comes to testosterone. We now have oral options. I think a lot of people are going to be interested. I know a lot of my patients have expressed interest.
Yeah, it's been great. In my practice, when I talk with patients, I find that many would rather just take a pill with their daily prescription and or supplements, particularly considering some of the drawbacks you just mentioned. It doesn't involve a needle causing pain. There's no risk of transference like you have with the gels. And it has been great having the new oral option with Kysotrex, which has been a first-line option for me.
Absolutely.
Well, you both have really delivered significant value today. You're both just a wealth of valuable knowledge. Before we wrap up, I wanted to really give you the opportunity both to share any final thoughts today with our listeners.
So I'll start here. I'd say as much as we feel that so much is out of our control, the day-to-day hustle, it's like sometimes we feel like a tornado is going around us and all our role is to just hold everything steady, that we have incredible control over our health. It's about investing in our health today. Otherwise, we're going to be investing in our sickness later. We all kind of go back to the marginal decade, the last 10 years of our life. And for many people, those 10 years are rotten 10 years. But what if I said that if we just start today making the next right decision and the next right decision, that potentially those last 10 years could be a beautiful 10 years? Would you believe me? It's true. Right? It's about picking that plain Greek yogurt with the fresh fruit instead of going for like a French toast with a ton of syrup on top. It really just starts with that first decision.
Yeah. And then the other point that I want to add, similar to what she was saying, is with the control. If any of the listeners have a question about their body, if you wonder, might it be a hormone issue? Might I benefit from talking with someone? Might I benefit from losing some weight and having someone help guide me on that process? You deserve to see a specialist to have that nuanced conversation. And while medications play significant roles in both of our practices, education, just like food and just like exercise, are the foundations of medicine. It's understanding what those decisions look like and just having baseline education, which is the beauty of your podcast. Because in order for someone to know what questions to ask, they have to listen to the content that you provide to have that baseline information.
Well, thank you so much for taking time out of your busy schedules to speak with our listeners today. Solid gold. I know I can speak on behalf of all of them here on the podcast that we really greatly appreciate you both for delivering your wisdom that we will all benefit from. Thanks again. Thank you again for listening to the Prostate Health Podcast. For those of you wanting to dive in even deeper, make sure to check out the Prostate Health Academy, which offers comprehensive and easy to navigate lessons that I have prepared for you. There's also an active private community forum, and I am there every day providing support, insight, and answering questions. To learn more, just go to www.prostatehealthacademy.com and click on Join Now. Well, that's it for today. We will see you at the next episode.